And then your blade needs to be going away from your body. You basically cut the umbilicus in this way, away from you, okay? Giving the trainees all those NICU secrets, teaching the families, bringing you physiology and the latest evidence in management of NICU babies. Just having fun with it. All right, welcome. I'm Dr. Ford, the NICU doc, and today we're going to be talking about umbilical line placement. We can actually insert an umbilical line or catheter into the artery, or we can insert that into the vein. The umbilical venous catheter, or UVC, the umbilical arterial catheter, or UAC. Okay, let's look at the equipment that we need. So first of all, because we are currently within the COVID times, we need the different type of equipment, and you can use the equipment that your hospital has you as sort of safe individual equipment. You can have your mask, your gloves. Obviously these would be sterile gloves. When you're doing all this procedure, you're doing this in a sterile fashion, so you would have your sterile gloves. You're gonna have your mask, either your regular surgical mask or pediatric mask, and then you can have an N95 or a combination. Again, you follow whatever regulations your hospital has you doing for COVID-19, or you can wear eyeglasses as well. Again, if you are no longer in restrictions for COVID-19, you can now go ahead and use regular equipment, which would still be sterile gloves. And again, if you need eye protection, then you can use these masks or the glasses. As far as the actual equipment that you need for the procedures, you can have an umbilical vessel catheter tray. Every tray is different. Some people use a bigger surgical tray, a sort of a general surgical tray, or you can use something like this that is already prepared for what we would want, which is the umbilical catheters. You're going to go ahead and need at least one catheter, and you can use a single lumen 5 French catheter. These are for bigger babies, or you can also choose if it's a smaller baby, or if you want to use it for the arterial side. If you're having problems with the 5 French, you can use a smaller 3.5 single lumen. They do make double lumen lines, and again, you go with the policies that are in your hospital as far as which lumen, which French size for the baby that you're going to be doing this on. Okay, so let's just go ahead and imagine that we are opening this tray, and this is exactly what you're going to see inside. So for illustration purposes, I will not be wearing full sterile gown. Like I mentioned before the start, I would normally have a hat, I would have definitely a mask and sterile gloves to be able to do this procedure. This blue covering on the tray on the outside is obviously not sterile, but on the inside everything is sterile. So I'm going to show you how you open the tray without contaminating anything on the inside. So as you open this tray, you want to grab the tips like so. And then on the last one, what you want to do is from the outside, you actually want to grab the tray without touching the inside, being very careful not to touch the inside. You grab the tray and you just very gently turn it to its side and over to be able to remove all the equipment there without contaminating anything. Now at this point, you can now remove this plastic tray and continue to set the stage. All this on the inside is sterile. So again, you are wearing your mask, you're wearing your hat, and now for sure you have your sterile gloves when you're touching this equipment. Again, for illustration purposes, I would not be wearing any gloves right now. So once you have this, you go ahead and set your stage. You put your umbilical catheter on the side. You can also see you have 2 different types of tweezers and then your scissors as well. And the first thing you want to do is actually prepare your umbilical catheter. What you're going to be doing is, and again, for illustration purposes, I do not have any normal saline or any fluid inside the syringe. But we're going to imagine that we would have fluid inside the syringe. The next step is grabbing your catheter and your three-way stopcock, and two of the ports are actually closed off right now. One is free. The free end with a little screw at the end is the one you want to go ahead and screw onto your catheter. This leaves two ports. The one that's parallel or continuum from where the catheter was just screwed on, you unscrew that lid and you go ahead and use your normal saline or whatever solution you've been given to go ahead and flush whatever your policy is at the hospital. You go ahead and hook that on there, and very gently you're going to be pushing fluid. So one thing you can do is, so you don't waste that fluid you've been given, you can actually use the same reservoir where you had your three-way stopcock and slowly push fluid in there. Once you see the fluid come out from the end, you can stop. You still have this port that hasn't been flushed. Now, where this is indicating, where the port is showing you and it says off, that's exactly where the port is off. So this little knob, it shows you where the port is off. You are going to go ahead and actually turn this knob off now to the catheter or the patient. That way the fluid stays there. You unscrew the side port and you can do the same thing. You're going to go ahead and give a little fluid through the side port. It's going to begin to drip there. And at that point, you can screw the tip back on again. And there you go. You turn this off to the side port, or you can leave this off to the patient, in this case, the catheter. Let's go ahead and actually get our patient so we can practice inserting the umbilical catheter. Okay, and so here we have our baby ready to go ahead and place the umbilical catheter, whether you're doing it in the artery or the vein. Now, if the baby happens to be moving a lot, if it's a bigger baby, you may need some support from the nurses to be able to help do some tricks to be able to help hold the feet and the hands in a way that is gentle, not cause any harm to the limbs, but at the same time be able to immobilize as best as you can the baby so that you're able to put the umbilical lines in safely. For illustration purposes, we will not be doing that with this baby. Okay, so now let's go ahead and place the umbilical catheter in this baby. We imagine again that we have this environment with the baby there. First things first, it's really important to follow your hospital's policies as far as what type of solution they use in your hospital to be able to clean and make the environment around where you're going to be placing the umbilical cord sterile. Some babies you can use povidone, in other babies chlorhexidine, and so make sure you know which solution you're going to be using for your hospital. So you can use an assistant, a helper, a nurse, a resident, or somebody else to be able to hold the cord up so you can then cut it a little bit closer to the area of the skin. To do that, before you get there, you have to go ahead and clean. We'll be using povidone or iodine. I am not going to open this for illustration purposes on this baby, but first thing you want to do is you want to be cleaning the cord from down up, and you're going to go around the area of the cord, cleaning it all the way as far up. You're not going to be using this area, but you're going to be cutting this off. However, you want to make sure everything is clean. Once you do that, you're going to be doing encircling that solution all around, and you don't want to go from outside in, you go from inside out. Same thing from bottom up, so you're not pushing any bacteria from the top down. You're going to be going bottom up. In this case, you're going to be circling and going center out, center out, center out, cleaning all this area. You have to do that at least 2 to 3 times. Again, make sure you follow the policies of your hospital. Once you have cleaned this, you can now do 1 or 2 things. We do need to remove this, so you can do it in a couple of ways. So you can, first of all, grab your umbilical tie, and then as the assistant is holding this up, you would basically be coming around, making a small tie around that, as close to the base as possible. You do not need to put a whole lot of pressure on the umbilical tie. It's basically just positioned there. Should the umbilicus, once you cut it, begin to bleed, then you can actually put a little bit more pressure to stop the bleeding. So once you've done that, you need to go ahead and cut the umbilicus now. You can get your scalpel, make sure the blade is away from you, and you can use something to be able to put some pressure on the back. Let me show you what I mean. As you take this off, again, make sure the scalpel blade is away from you. And same thing, what you do is as your assistant is holding this up, you can actually now come in behind, and you want to cut about 1/2 centimeter above the skin. You come in and put some pressure in the back like so, and then your blade needs to be going away from your body. You basically cut the umbilicus in this way, away from you, okay? And you do not want to do a serrated cut. You really want to go in and cut like so. Let me demonstrate it if we were doing it this way. Okay, you're going to be coming like this, and again, you can either do it this way where you're cutting like this. You do not want to be cutting towards your hand. You always cut away from your hand, and you make one clean slice like so. Once you do that, the way to make sure your scalpel is safe is the one hand. You go ahead and cover it with one hand. A second way to cut the umbilicus is a way in which you can actually keep your ties still sterile. So what you do is you grab your little paper dressing, the one that doesn't have a hole. You can fold it right in the center like so. And using your scissors, you can actually make a small triangular cut like this. And then you open this up. Your assistant, who has the umbilical cord put like this, will help you in placing it through that hole. Again, since you are sterile, you can now use your equipment, hold the catheter, you cover the baby, keeping it sterile. Make sure that if the baby has a tube or device, that you're being very careful not to fold and cover and not be able to see if there's any kinks in the tube. So you be very careful, leave a little space if you can. Same thing for the feet. You want to make sure it is easy accessible so you will be able to see it later once you place the catheter. So now your assistant is still holding this. You give this to your assistant to keep on holding this umbilical line up. And then you can now go ahead and use your tie. Remember, your hands are sterile because you have the sterile gloves. This has maintained is still sterile. And so you tie this around, move it to the base of the umbilical line, of the umbilical catheter. And this is now sterile. So therefore, if something were to happen, you have maintained this being sterile. It is not contaminated, and you can very easily do this. If we had done it the way I showed you the first way, it would be under your sterile dressings, so you have to ask somebody to put some pressure should the umbilical cord start bleeding. Now with this, again, you take this off, and this will be now discarded as it is contaminated. And here, now you can use the second one if you want with a hole. You can now put this in here like so, pull this through, and now you have basically 2 layers of sterile towels or sterile papers in case the bottom one were to slip out, move, or the hole were to open up. You have your second one in place. And now we're ready to go ahead and cut the umbilical cord. So cutting the cord, as I explained in the first one, we'll put some pressure behind this. If it's laying down, you go ahead and cut it about 1/2 centimeter to 1 centimeter, like so. And away from your body. This is obviously a little plasticky, so it's not exactly the same. But there you go. This would be now discarded with your assistant. And you go ahead and do one hand to put the lid on your scalpel. And there you go. We are now ready to go ahead and place the umbilical catheter. Okay, so when placing the umbilical catheter, you go ahead and grab the catheter. You remove it gently from its sheath, being very careful, and this is where you can use your tweezers, being very careful to grab the tip. A lot of the time, because this is very flimsy, it can move out of your sterile your sterile field, or if this was somewhere else, anytime you're transferring, you do not want to transfer like so. You grab the tip always, or close to the tip. You try not to use your gloves because it can have powder and it can cause some irritation to the catheter, so you always want to grab the tip like so. And here you're going to go ahead and identify your vein and your artery. The vein is usually pretty collapsible. Obviously here we see it nice and round. It's kind of collapsible. The edges are very thin. The artery tends to be a little bit more rounder and stiffer, and the edges are a little bit thicker. Once you identify your two arteries and your vein, you decide where it is that you're going to be placing this. In this case, we've already calculated the length of insertion. Length of insertion for the umbilical catheter is 3 times the weight plus 9 for your UAC, and for UVC it is half that number of UAC plus 1. Now before we can insert the umbilical catheter, we actually have to go ahead and open up a little bit wider the holes to be able to insert the catheter. One way to do this is to go ahead and get your Kelly, grab the edge of the umbilical cord, and you can either, if it's big enough, you can insert 2 of the blades of the tweezers like so and make small rounding movements to try and open up that area. If you're going for an artery, you may need to insert just 1, and again, same movement, you make small circular movements like so to try and open. If it is now wide enough, you can insert 2, open and remove. You insert it together, open and remove, and doing that continuously for a few rounds will allow that artery or vein to open up and be ready for you to insert your umbilical catheter. Now we are ready to insert the umbilical catheter. What you want to do is always try and avoid using your hands to hold on to the catheter unless it's beyond the area that's going to be inserted. Sometimes in an emergency case you may have to do that. But you grab your tweezers right at the tip. With your Kelly, you stabilize the umbilical cord like so, and you slowly insert it. You're going to be pushing in slowly. Keep in mind this is plastic on plastic, so obviously even with a lubricant, it's very difficult to insert this into the umbilical catheter. So we're going to imagine that the catheter has gone in to the length of insertion that you have calculated before. So as I mentioned, you have now inserted it to exactly where you want it. You can now put this down. So you may have inserted, but you want to make sure not only are you in because of the length of insertion, but are you actually inside a vein or an artery? The way you can test that is you make sure you're always facing up like this. You do not want to be pulling sideways. You want to face up. This is now closed off to the patient, but you're going to be trying to draw some blood from the patient. So you open this and place this to the side port. Now the side port is closed, which is now allowing you to be able to get blood from here. So you slowly pull back to see if there's any blood that's coming out from the patient. We will imagine for simulation purposes that we are actually getting blood back and we're in the right place. You now close this off and you are now ready to go ahead and suture. You have your suture kit. So you use your suture, open it up like so. There is the needle. You grab your needle driver and slowly pull it up from the center. Again, be careful not to contaminate this end. And now what you want to do is make sure that when you grab the needle like so, that you actually try and grab it right at the center of the needle, a little bit behind that, and as close to the tip as possible, like so. Notice that I'm not using my finger to hold on to the needle. As best as you can, train yourself to be able to use your instruments to hold on to things. Okay? So there you go. All right, and now we are ready to take a small bite from the umbilical cord. Really important when you're doing this that you're not putting the tip of the needle into the catheter, but you're actually putting it into the umbilical cord like so, and you're taking a bite so that the tip of the needle is looking away from the actual catheter. There's no chance that you're going to puncture that because you're going in and away from the catheter, like so. So you take a bite next to that. You want to leave a little space. And now go ahead and do your surgical tie, which is you grab your instrument. And you're going to go 1, 2. This is your instrument tie. And you grab the other end and you pull it through. Like so. Okay. Now you're going to go ahead and we're going to go underneath the tie right here. We're going to go 1 loop and then grab the tip on the other side and pull through. Like so. Okay. Now listen, since we went underneath the next one, we're going to go on top of it and go over and around and grab the tip. Okay, and you can do this. We've done 3 now. You can do this 3 or 4 times. I'm going to do this 4 just to show you. We started out going underneath. The next one we went on top. So the last one we'd go underneath. And again, you wrap it around and you pick up the end. Like so. Sometimes it does get tied up to on something, so you just loosen it and there you go. Okay? Okay, so now you've secured the tie to the umbilical cord, but we need to go ahead and secure that catheter. Now there are so many different ways to go ahead and secure the umbilical catheter to the umbilical cord. I'm just going to show you one that I was taught during my training that I use on most of the patients. So now basically you just go ahead and grab one end of the silk tie. We'll go with the one without the needle. And you actually take this behind the catheter. This is going to cause this to create a hole or a loop. And you want to feed that through the loop. Like so. Feed that through the loop. You can either do that or you can grab it with the instrument and pull it through. See, I went right into that. Good. There you go. And this is now going to hold the catheter on one end, but you can see how loose that is, so we're going to use the other end. And now you do the same thing with the needle end. You grab the needle end, bring it around. Notice that I'm using the instruments, not my fingers, so that I don't cause any risk of me poking myself with that. And see how I've gone behind and see there's a loop that's been created right here. So I'm going to bring this back, and again, I can go into the loop, or I can use my instrument, grab that, make sure the loop is still there, and bring it through the loop, like so. And I'm going to push this down like that. So now I've got these two ends, okay? We're going to do this 3 times each side. The idea behind this is that you use 2 competing forces around the catheter. If you have your catheter in the center and you have a force that's pulling it this way and a force that's pulling it that way, they're competing in holding each side of the catheter in perfect place. So I'm going to repeat this one more time. I'm going to go behind, create this loop, and I'm going to pull it through like so, and bring it down to the bottom. You always want to try and bring that loop all the way down to the bottom. Same thing here. I'm going to go behind, and I've created this loop right here. I'm going to bring this right through the loop. Okay, same thing. Take it down to the base. Once I do that, I pull in the string on the silk, and we would repeat this a 3rd time. Okay, we imagine we've done this 3 on each side. Now we can do our instrument tie again. We can go ahead and grab this, go 1, 2, grab the tip, like so. Okay, same thing. Remember, we're going to go, let's say, from the front, and we're going to wrap this around, grab the tip. Remember, this is a video, so you can stop, you can rewind, you can go back, do it slow motion if you need to. Now we're going to go behind, create this loop, like so. We're going to go in the front, create your loop, like so. Behind, create your loop, like so. And there you go. Now it should be fixed, and we can test this by seeing if it moves at all. Now let's imagine that it does. Let's say there's a lot of movement in that the catheter moves up and down. With really small babies, you don't want it to be moving up and down. You don't want to have a lot of wiggle room in that catheter, because again, with small babies, that distance of even half a centimeter could be going in and out in a different part of the anatomy. So what you can do in this case is actually take a bite from the other side. If we've taken a bite on this left side right here, well, why don't we take a bite on the right side, like so. Now, as I mentioned, you do not want to ever take a bite into the catheter. So what do? You go ahead, grab, take a bite, make sure it's always, the tip is always going away from the patient. Again, I apologize, this is very plasticky, so it's a little bit more tense. You take a bite right there, and you see how it's already beginning to approximate? Good. And then now you do your instrument tie. I'm going to do this fast because you've seen already 2 of them. And we go like this, and we go like this, and we go like this, and then you're done, okay? So now you should have no movement. Not only have you wrapped around 3 times each side, but you've taken a bite from one end and you've taken a bite from the other end. So this, and again, be careful not to use your instrument to hold on to the catheter like that because it has teeth. This should not move at all. Okay, when you're taking a bite from the other side, make sure you're not obstructing your other sites of entry, your arteries. And with that, we can say we've secured that catheter really well to the umbilical cord. Now you can go ahead and repeat these steps for a second umbilical catheter if you need to do a UAC or a UVC. Once you have completed this, you can go ahead and cut. Usually you want to go ahead and cut a few, maybe half a centimeter to a centimeter. Usually half a centimeter is good enough. Notice how I hold the scissor, and you've got a point with your finger so that you have really stabilized your cut. Okay? With that, you have now completed this procedure. At this point, you can now go ahead and decide to get an X-ray just to make sure that you're in the right place, or you can take the dressing off and get an X-ray. Again, follow your hospital's policies as to how you do this part at the end of umbilical line placement. Always very important when you have completed that all your needles and anything that is dangerous is put away in a safe place, and you put your instruments back. And always, if you have time, and you should have time, make sure you clean up your mess. Just like mom said, you make a mess, you clean it up. Same thing with procedures. If you use this, don't just walk away and ask somebody else to do it. Again, if you have the time, there are emergencies sometimes. But if you have the time, every time, go ahead and clean it yourself. Okay, and with this we conclude umbilical line placement procedure. I hope you really liked this video. Let me know if there's something I didn't cover. If you have any questions, please add it to the comment section. I'm happy to answer anything that I can for you. Again, I appreciate the time, and I always appreciate the support. So please, go ahead and like this. Go ahead and subscribe if you haven't subscribed, or if you don't follow me on Instagram, follow me. I'll be doing other videos. I'll be doing other procedures. And so thank you again for your time. Been a pleasure. Have a great day.